very good evening. Greetings for the day. I'm Sayukta from All About Skin Wellbeing, and I'm sure all of you must be keeping in good health. We all know taking good care of our skin is important for more than just the appearance. As the largest organ, your skin becomes the most essential to your overall health. A fungal infection is quite common. It can, appear on your skin or nails or many times on your scalp, and it can be really itchy. So let's connect today with our skin expert, Dr. Alagammai K, who is joining us live from Chennai to enlighten us on the topic of fungal infection. She is MBBS, MD, DNB, TBL, and she has rich experience in this field. And she is currently practicing at Maida Skin Clinic, Chennai. A very warm welcome to you, Doctor.
Thank you for the welcome. It's a pleasure joining you.
Thank you, Doctor. It's a pleasure for us as well. And as we are going live on the topic of fungal infection, first of all, we would like to understand what is fungal infection and what are the body parts, the areas which are, more prone or at risk of having fungal infection.
Okay. So fungal infection of skin, there are different types of fungal infections. The commonest thing that we see is ringworm. So we get many patients having ringworm visiting our clinic. We also have other types of fungal infections like deep fungal infections, which is not so common. So if you take ringworm, it's caused by dermatophytes. Dermatophytes are fungus which affects areas where there is a lot of sweating in our body itself. It affects the areas with a lot of sweat, sebum producing areas. So there are the parts which are affected by fungal infection. It includes the scalp, then all the folds, intertriginous areas we call it, the axilla, inframammary region, groin. These are all common parts affected, common sites affected with fungus. There are also other parts of the body like hands and feet also get affected with fungus. So basically any part can get affected, but these are all more prone areas.
Right. Now, doctor, we often say, especially in medical field, that prevention is better than cure. Any way that we can prevent having fungal infections, especially in this season where we are experiencing monsoon in most parts of our country, and it's really hot and humid?
Yes. See, fungal infection can be, uh, it is more common when a family member has a fungal infection that the other family member can be infected by it. See, what is the reason behind this? If they are using if they are sharing their towels or clothes, then it can spread that way. Or if they are sharing their soaps, it can also spread that way. And if you don't dry your clothes properly, and if you're wearing wet clothes, that can also retain the fungus and it can also aggravate the disease or it can cause recurrences. So proper hygiene is very important, and also wearing dry clothes, not sharing things between your family members. These all can prevent fungal infection.
Right. Doctor, because we are talking about fungal infection, and a very common tendency in our society is to go for over the counter topical application. We normally immediately do not go and consult a doctor. Not all of us do that. And the most common things that come to us quite handy is going for a home remedy, a DIY, or going to a chemist shop. And we keep on using that, whatever topical application they give us for months and months, and we feel that it's okay. I mean, we are cured with this tube only. So what's your take on these over the counter topical applications and other home remedies or DIYs? Do they really work or they worsen the condition?
Okay, thank you for asking this question because this is something very important we need to address in relationship to the fungal infection. Basically, the over-the-counter medication that generally contains steroids. So why a person feels cure with that over-the-counter medication is any steroid, it will reduce the inflammation in the first 2-3 days. So in the first 2-3 days of applying those medications, immediately the infection gets cured and everyone feels that, okay, this is the best cream, it works for this. But again, after a few days of stopping it, maybe after 3-4 days of stopping it, the infection gets aggravated. But still, what they do is again and again they keep applying the creams. and it leads to a condition called tinea incognito, which means steroid affected fungal infection, which requires treatment for a longer duration of time rather than the classic treatment for fungal infection. So it's better that anyone avoids any home remedies or self medication from over the counter.
Right. So, in case you have fungal infection or anything which is not common on your skin, please go and consult a qualified dermat rather than going for home remedies or DIYs or over the counter topical application. Another very common tendency, and I'm sure you also get patients who have done that. For example, I am a patient, I had fungal infection, I came to you, you gave me a prescription of, say, 1 month. I'll follow the prescription religiously for, say, a week or 10 days. And as soon as I start having some relief or, some signs of relief, I'll stop following the prescription. I won't even inform the doctor, nothing. And again, in case I see the lesions, I'll start, taking the medicines and the topical application because I have the prescription. It's again a very common tendency. How bad can that lead to?
Yes, it is very important to strictly adhere to the treatment that we are giving you, especially the duration of treatment. See, within 10 days of using any antifungal tablets or creams, even that the dermatologist is prescribing, the ringworm it tries to fade off. So that is not the stage when the treatment has to be stopped. It has to be the treatment duration for any fungal infection generally recommended is 4 to 6 weeks. 6 weeks. Okay. So within 10 days, if they stop the treatment, they are more prone for developing recurrences. Again, recurrences require a longer duration of treatment. So I would recommend visit your dermatologist. Whatever treatment they are giving, either tablets or creams, along with that, if any sprays or lotions are given, whichever formulation is given, strictly adhere to the time frame of treatment which is given to you. And also, if they are asking you to come for follow up, please do visit the doctor
Hmm.
again, because generally we will not be prescribing it together for 6 weeks. No one is going to take it for 6 weeks because within 10-15
Right.
days they will come. So that is the reason we generally ask them to come back after 20-30 days to see how the response is. Whether the response is good, then we might tell stop tablets and continue the creams, or we might give other tablets if the response is not good. So in that case,
Hmm.
better go for a follow up, get it confirmed from your dermatologist when the treatment has to be stopped, and then only the treatment has to be.
Right. So, as you said, doctor, recurrence of fungal infection or we getting resistant to fungal or antifungal medication, it's becoming quite common, or it's the cases are continuously increasing these days, right?
Yes, yes, very common. The main reason for this, I find, is that patient is not strictly adherent to the treatment duration, as you have rightly
Hmm.
asked in the last question. And the other reason is resistance. Resistance is not very common compared to the non-adherence
Recurrence.
of treatment. Resistant part is much lesser. Sometimes we do see resistance in some patients for whom we will be changing the antifungal drugs. But otherwise, I would just recommend that strict adherence to the treatment frame duration itself will prevent the recurrence in most of the days.
Right. Now, doctor, when a patient comes to you with fungal infection, are there any tests that you normally recommend, or just by physical investigation, you're sure that this is fungal infection?
See, generally, ringworm, it is a clinical diagnosis. Okay. So when we have doubt is that if a patient generally the first time, it will usually be a clear-cut annular lesion. So we'll be able to confirm it just by clinical examination. There will be doubts arising when they have used over-the-counter medication because the morphology of the lesion it would have changed. The proper annular lesion might not be there, and the patient might be having the lesion for 1 or 2 years. I've seen patients coming with full-blown redness in the body because of using the over-the-counter medications. In those patients, it is difficult to tell it is fungal infection. So in them, we do a test called KOH mount, which is basically scraping of the skin lesions and examining under microscope after adding some chemicals to that, uh, so that the fungus is visible to us, and we confirm the diagnosis by that. Okay. So this is some basic test which can be done in 15-20 minutes. But we do not do it in all patients. We do it only in doubtful cases or recurrent patients, recurrent lesions. When it is there, we do such things.
Right. And what is the treatment of fungal infection, doctor?
Treatment is basically antifungal drugs. We have various drugs under this category. Mainly, it is oral and topical application drugs. Oral drugs, we have azoles mainly, like fluconazole, itraconazole. These are the drugs given. And topically, we again have azoles and allylamines. These are all like topical antifungal agents. So both of this should be combined for about 4 to 6 weeks. And apart from that, symptomatic treatment is also required. Like if there is too much of itching, we will give them antihistamines that will reduce the itching. And we will also advise them personal hygiene, keeping the areas dry and washing the clothes and drying it under sunlight before using them, or iron the clothes and then use them. So these things will help in reducing the recurrence and yeah. Apart from the medications, these lifestyle modifications are also required.
Fair enough. And doctor, now coming to the fungal infection of nails, who all are at risk? How does it look like? And what is the treatment protocol again?
Okay. So fungal infection of nails, the nails will turn either whitish or yellowish. It can be either in the distal part or in the proximal part. Any part of the nail can get affected by the fungus. And long-standing fungal infection of the nail can cause gaps between your nail plate and the bed. Okay. So this is how it looks like. And who is prone to develop this is any person working with water, contact with water for a longer time. They are prone to develop this kind of fungal infection. Um, and also who has been having fungal infections of the body for a longer duration of time, they can also develop fungal infection of the nails. And treatment wise, the drugs are the same, but the duration of the treatment differs. And we also have some special applications for nails. Yeah.
Okay. Similarly, for fungal infection or for foot fungal infection, especially for those who, are in such a work culture where they are bound to wear formal shoes, leather shoes, socks for very long durations. Any preventive measure they can follow to prevent having fungal infection of foot or toe?
Yes, this is called athlete's foot actually. So those who wear socks and shoes for longer duration of time, they're prone to develop either fungal infection of the nails or in between the toes, they will develop something called intertrichome. This is again because of the water retention, sweat retention. So one way to prevent that is instead of wearing shoes, they can wear chappals or other footwear where aeration is better, and they can also apply dusting powders which will absorb the sweat. So that will also help them to prevent this fungal infection.
Okay. Now
And
coming to the
there is one more thing is whenever there is sweating, just pat dry the sweat. That will also help in preventing the fungal infection.
right. Now, doctor, coming to scalp-related fungal infection, again, who gets it more, and what is the way of prevent it, and how was the treatment done?
See, in scalp, this ringworm, that type, it is more common only in children. Okay, so in children,
Okay.
they patchy hair loss with some scaling visible on the scalp. That is one type of scalp infection. The other one is dandruff. Dandruff or seborrheic dermatitis, we call it. It is actually not an acquired infection. The fungus already persists in our body, but not to the level of causing any symptoms. But sometimes in winter, when the dryness aggravates, the sebum dries out and it causes scaling of the scalp. And that time, the fungus also grows a lot and it causes itching and other problems. So these are the infections of the scalp. The way of preventing it is, I would recommend frequent hair wash. See, the way of preventing dandruff is alternative hair wash, or at least a minimum of weekly twice the hair has to be rinsed. And for children, not much can be done to prevent the disease, but once they acquire it, the earlier they come to the dermatologist, it is easier to treat the fungal infection of the scalp.
Okay. In case of scalp, doctor, we have this old good tradition of applying oil on our scalp, and we do it for as much hour as possible. So because we have a belief that oil massage or oil on our scalp will actually lead to good luscious hair. But in case there is fungal infection, how good or bad that oil can be for our infection in that case?
Oil application actually aggravates fungal infection because oil is a good growing medium for the fungus. So generally, we recommend the patients not to apply oil over the scalp. See, if at all they are prone for applying oil, I would recommend them to apply it for the shaft of the hair rather than the scalp. For the shaft, it can be applied, but for the scalp, I would recommend them not to apply it. And yeah, that's about it. And then continue with the treatment.
Okay, so getting treatment and completing your treatment is very important. Now, doctor, we are getting many questions from our viewers. I'll take few of them. Pooja
Sure.
Sharma is here, and she's asking: can water park or swimming pool water cause fungal infection?
Not per se. Actually, viral infections are more common in swimming pools,
Hmm.
acquired viral infections. Fungal infections, I would recommend, see, before going in, getting into the pool, wash yourself. Again, coming after the pool coming from the pool, after that, again have a wash, and that will pretty much prevent the fungal infection.
Right. Lucky Sharma is here, and his question is: can we go out in case we have fungal infection? Can we go out in public or socialize? Is it okay?
Yes, definitely. You can socialize, you can go in public. It's not that you have to isolate yourself. Just take proper treatment, and whatever you want, you can do everything like a normal person.
Right. Uh, Sona Sharma is here, and her question is: can makeup products or applicators also lead to fungal infection?
If the makeup product is used by a person who already has a fungal infection, and if you're going to use the same product on yourself, then there are chances. Otherwise, not at all.
Okay. Do fungal infection leave any scar on the skin? Is what Feroz Khan is asking.
It doesn't leave a scar, but there is something called post-inflammatory hyperpigmentation, which means that the raised lesion which is there in the skin, it becomes flat and it gives some color to the skin like black color. So that pigmentation also, it is not permanent, it is temporary and it resolves within like 4 to 6 months.
Okay. Right. Ria Sati is asking, Doctor, can sharing clothes with friends, can it lead to or cause fungal infection?
There are chances it can cause. I've already addressed this actually. There are
Mhm.
chances of fungal infection spreading by sharing the clothes with your friends, like without washing it. If you wash and share, it should be like properly cleaned, dried, or ironed, and then only you can use it. But it's better to avoid sharing.
Right, Doctor. These days, when, as we have already discussed, it's raining in most part of our countries, and we don't see sun for days, and properly drying the cloth under sun is many a times not an option. What to do? Because do these wet or damp clothes can also cause fungal infection?
Yes, in that case is no. In that case only, it's better to iron your clothes and wear it, so that
Okay,
heat will prevent the spread of the
right.
disease.
Okay, doctor. And doctor, in case of pregnancy or in case a lactating mother is having fungal infection, then what line of treatment you normally adopts?
In pregnancy and lactation, we generally prefer topical creams rather than giving systemic drug oral tablets. We prefer to give topical creams. If the infection is very extensive, if it affects too much of area of your body, then in that case there are some pregnancy safe oral antifungal tablets which can be given. Especially it is avoided during the first trimester of the pregnancy, but otherwise, yeah, my first line of treatment for any pregnant or lactating patient is that I give topical creams, and to reduce the itching I'll be giving tablets for them. If there is no response or if there is no improvement, then I might switch over to oral drugs.
Okay. I'll take one last question from our viewer. Ramesh Solomon is here, and his question is: we often use same soap for bathing, but in case one of the member is infected with fungus, is it a okay thing to use the same soap?
I'm not getting the question clearly. Is it about using the same soap among all the family members?
Yes, right.
Okay, okay. See, whether there is fungal infection or not, I wouldn't recommend this practice. I always tell my patients use separate soaps for yourselves unless it is a liquid soap. Liquid soap, it is fine to share it among the family members, but if it's a solid soap that is going to be used, I would always recommend separate soaps, and that too when a fungal is there in any of the family member, soap should never be shared.
Right. Doctor, we have already, discussed so much about skin superficial fungal infection or fungal infection of nails or scalp. Before we wind up the whole session, anything, any point, or any take-home message for our viewers?
The main thing I would tell is, see, fungal infections are very common. It's a very common skin disease. You identify it when there is a round lesion in your body, anywhere in the body, usually round. It is reddish. Visit a nearby dermatologist. Always take recommendation from the dermatologist. Take proper treatment, what they are suggesting you. Take it for the um, required amount of duration till when the treatment is given to you, and you will be free of the fungal infections 90% of the time. Recurrences are not very common when you take the treatment properly. This is my message for you all.
Thank you so very much, Dr. Alagammai. It was wonderful talking to you. Thank you for making the whole topic so easy to understand for all of us. And thank you for making this session so informative. Thank you once again.
Thank you so much.
Thank you, Doctor, and viewers. Thank you for your excellent participation in this session. For more information and updates on skin health and care, stay connected on our FB page, all about skin well-being. We are also available on YouTube, Twitter, and Instagram. Thank you, and have a great evening ahead. Goodbye.